Thank you very much for coming. My name is Aaron O'Toole, and I have the honor to be the Member of Parliament for Durham. I also am honored to join our friends here at Durham College this morning at the Global Classroom in the Center for Collaborative Education, keeping with Durham College's tradition of being the most innovative college in not just Ontario, but in Canada. And hello to people watching on Facebook Live. As I joked this morning, this is my best attempt at a Steve Jobs moment. I'm in front of a screen speaking to you here and speaking to you online because we're launching a very special project this morning. But being here and being able to show an online resource for people wouldn't be possible. So thank you to Don Lovisa, Peter Garrett, and the whole team here at Durham College. It is truly appreciated. So, saying that, welcome. Today we launch the Durham Wellness Hub. What is the Durham Wellness Hub? It is a way that we can bring people together to talk about mental health issues and wellness by providing information and connecting people with service providers, groups, programs, and supports in their community. The great thing in the last number of years is we've been reducing the stigma associated with talking about mental health and wellness. Many of our mental health professionals here from Durham today have been a part of that conversation. We've even seen corporations do it. I was in the Canadian Armed Forces. The first time I ever heard the term operational stress injury was when my squadron was responding to the dreadful crash of Swiss Air Flight 111 20 years ago. So in the last 2 decades, uniformed services like our police and fire, the Canadian Armed Forces, educators, we've all been reducing the stigma, because the faster people start talking about their injury or their mental health issue or a mental illness, the faster we can plug them in to support and to help and get them on their journey to wellness, as I like to call it. And that's what the Durham Wellness Hub is all about. After we have the talk, whether it's on Bell Let's Talk Day or the first few weeks of a new semester when you have new students facing the anxieties with that, we need to take the talk and turn it into collaboration, turn it into action, and turn it into learning. And that's what the hope I have with the Durham Wellness Hub is. So today, we're launching a new tool. For the last 8 months, I've consulted with many groups, service providers, professionals, constituents, telling me their own stories about dementia, of a loved one in the home, about youth mental health, about the impact of suicide in the community. So we wanted to take that and launch it into a tool for people to turn the talk into collaboration, learning, and action. And that is what we're going to have with launching this new tool today. That's why we're doing a soft launch of our beta site to give this as a tool to anybody who wants to seek supports in their community. Next slide, please. So you'll see the DurhamWellnessHub.ca is meant to be a user-friendly information guide. So years ago we had the yellow pages where you would consult to see where is an option, where is a clinic, where is a service group doing something for mental health supports. Now we all turn to Dr. Google, or we turn to the internet. So the Durham Wellness Hub is really that directory of service providers, partners, healthcare professionals, whether at Ontario Shores, whether at Lake Ridge, whether the Mental Health Association in Durham, and thank you for being here this morning. We and my team have consulted widely, and we're bringing these tools to one site that people will find and allow it to be a gateway for them to learn more, to seek out additional information, and to hopefully connect with a program here in the Durham region that they may not have known existed. What my team found most surprising from our consultations over the last 8 months was the fact in some cases, mental health professionals in the community didn't know there was a youth drop-in center in that same community. Some people that I met that didn't know they didn't have insurance coverage, but they didn't know there was a community living program that was a free resource for mental wellness that they could try and action to talk and to start their journey back to wellness. So even in the last 8 months of our consultations, we found bringing this information to people help educate and help connect them with the help they need. So with this soft launch today, we're trying to not only let people know it's out there, we want to engage partners in the process to get feedback from you to turn the beta site into a world-class tool, bringing people together with what they have. So now I'm going to take you on a little tour of the Durham Wellness Hub. From the vantage point of someone exploring the hub after being worried about a loved one or having their own mental health or wellness issue that they want to find more information about. So we will have this tool Google optimized, so it will come up as an option, and we've tried to make it design friendly and easy to access. You would note the disclaimer at the top. This is not just the lawyer in me speaking. It's important for everyone to know that this is a tool. This is a guide. It is not a substitute for professional medical advice or treatment. We all know, however, that people will consult and look into issues, whether it's anxiety, sleeplessness, whether it's something happening with a loved one in their family. So we want to give them information and allow them to connect to the appropriate service provider, healthcare professional in the community. And you'll see we do that in a number of ways. So the disclaimer is one thing, but if you scroll down, you'll see how we make it easy to navigate. We make it a live site, so there's the weather. I wanted to make it as a wellness site sunny every day. But like life, it's not always sunny, but the very fact we're putting in there, we want people to know that this will be monitored and updated, but it's not a wellness diagnostic tool, it's information. But it is going to be a living, breathing site and hub for people. And if you go, it's easy to navigate. There's resource directories, community events, which I'll walk through, all the way down to a message from me at the bottom, which outlines the goal of the hub and is intended to start a conversation that I hope continues. And my goal is that some of the partners involved in this may take it on entirely. And if I can push the boat out of harbor, I'm more than happy to not be the captain of this initiative, but I'm passionate about it. And if you go down right to the bottom, we've got health and wellness calendar, which we'll get into a little bit in a moment. And we've got social media access too. So today as well, Hub Durham is launching on Twitter. I think we're just doing the first tweets this morning. Talk about going on Twitter, that affects your mental health. It does to me every day, literally. And Facebook as well, which we will then cross-pollinate people that may find it through Facebook. We can refer to the website and so forth. And then at the bottom, we also have the ability to connect with us. And connect with us is an option where people can send a message, but it's basically meant on getting feedback about the site and trying to get more providers and groups in the community, in the Durham region, being willing to help populate and provide their information and correct any information that we may have gathered in our 8 months of consultation that may be old or needing updating, so people can connect and update in real time. So let's try our first search of the Durham Wellness Hub to sort of show you how we intend it to be used as a tool to help people. So search one, somebody would go in to the resources tab. And under resources, I'm faster than the web itself. You'll see we've broken it down, and these aren't going to be static. In fact, already this morning, we've decided we're going to add a few more tabs. And a lot of information is cross-pollinated amongst tabs, because somebody may look under a certain subject, and that group or that service provider may offer to many more. But we're going to break it down in this way. So click on mental health. And right off the top, since that's the core of this site, you're going to see we have two distinct tabs. We have counseling programs and walk-in clinics, and we have organizations. What if somebody is not at crisis? And so we have the disclaimer saying if you're in crisis, make sure you call 911, get supports right away. But if someone wants, in the next week, to really talk to someone in a counseling session. Under walk-ins, there's the Durham Counseling Walk-in Clinic, which when we told some of the people we've been meeting with in the last 8 months that there is a weekly walk-in clinic specifically for mental health counseling in Whitby, a lot of the people, it took us months to find out that that resource was out there, and a lot of people don't know that each week at Whitby Mall there is this resource. So you'll see, it outlines the information we've gathered from the provider, and if you click on Visit Website, here's where my fingers are crossed, we link to them. So we don't ever profess to be the subject matter expert here, we're trying to be the hub, connecting, collaborating, educating. And in this case, the walk-in clinic each Wednesday is a great example of 5 different organizations coming together to provide this service in the community. Service organizations, service agencies. So a great example of a resource that's out there now that we found that most people didn't know about. So we're going to make sure that we disperse this information a little wider as part of this. So now if we go back, we see under that tab we had the 2 sections, you recall. We had counseling programs and walk-in clinics. Let's look at the organizations themselves. This is an example of how much is out there in Durham. There's over 25 organizations and service agencies providing information, support, and sometimes drop-in or referral work for people with mental wellness issues. I was blown away by the number of agencies and organizations and advocacy groups connecting people. So we're allowing people to find out and to collaborate more with those groups. In fact, if you look at the extent of our site, which is still growing, and we hope partner organizations will help us grow, there's already well over 100 distinct agencies or organizations providing information or support within the Durham region alone. That's pretty incredible. From a world-class facility like Ontario Shores, right down to small groups of people organizing around a specific issue that's affected their family. The hub is a way that we're trying to bring it all together and provide people the pathway to see it. So if we click on the Mental Health Association of Durham, and they're here today. Hey, thank you for coming. We have information on that key player in the community, and we invite people to visit that website where they can find much more detailed information on what the Mental Health Association here in Durham, a national group, but what their Durham presence is doing. And the tools on their website alone are remarkable. And no, I didn't steal the hub name from this video. And we already had it in mind. So we're not trying to suggest that the Wellness Hub is the one-stop shop. We want people to be able to explore and find out more from the agencies and partners. And we've designed the site to allow for that to happen. Go back and we'll start search number 2. Search number 2, people might come in with a specific need or something that identifies them within a specific community. And that's the goal of this. So if we go back to resources, we've even tabbed a number of specific tabs within that page outside of a broad heading like mental health. You see there's specific resources for Indigenous Canadians, but let's highlight LGBTQ as one of the categories. As we know, studies have shown that young people facing issues with respect to their sexual orientation or identity often have higher instances of anxiety and other mental health and wellness challenges. This will be a resource to let them know there are a lot of ways they can talk and collaborate within the Durham region. In fact, this was an area we were actually very, very happy to see a wide cross-section of groups trying to make sure that there was a place for these young people and older people in some cases to plug into. So let's click on one of them, the PFLAG link on here. This is one of the unique groups within the community that not only provides something in the case of a young person, but also for family, and to keep tools available for all. So parents and friends are part of PFLAG's mandate. And if you visit their website, we're once again allowing that gateway straight to the specific organization or group. So the hub isn't really a gateway to allow people to find people to talk with, find supports, and let people start their journey to wellness, as I call it. Now, this is a good way to segue into another way the site works. So if we go back to the site and we go to the events calendar, we've also started populating a monthly calendar to let you know what there is out there. So sometimes some of the partner organizations or groups are doing things, whether it's mental health talks in libraries, whether it's gatherings, whether it's events. We're going to allow a community calendar to be part of this site. And if we go ahead to May, so 2 months ahead there, Mark, we're now populating, and we're hoping that organizations will start populating these calendars for us. Once we get through the beta launch, organizations will have a direct login to be able to update the calendar themselves. So if a location for a meeting changes, they don't have to come to my team. They will have direct access to the site to populate. And we're hoping this will show people that there's a lot of abilities to talk out there. There's a lot of people, in some cases, facing the same issues. So let's click on May, and let's click on May 17th, if we can see it on there. There we go. Click on that, Mark. This is an example of the group we found earlier through the resource tag, PFLAG. And in Bowmanville, they're doing an event related to the Rainbow Crosswalk in Bowmanville. So an example of people might find a way to connect with this group through the calendar, or they may find it through the resource tab. But either way, we want the hub to provide as much information to them, to connect with people, to collaborate, to learn, and as I said, to not be alone or isolated when they're facing mental health challenges or wellness issues, or they're worried about a family member. So that leads us to search for, and I said support for a family member. We also wanted to have some basic tools to allow this to be a site for people that if they have concerns about a family member going through difficult circumstances, or a first responder coming off a very challenging operational stress environment that we see our firefighters and paramedics and police officers often facing. We have the ability for the Support Others tab. And again, this isn't a diagnostic tool. It's not a college level course we're providing. We're providing a basic set of steps that we've taken from medical guidance and the advice of mental health providers on allowing people to look into how to provide help to their loved one or their family member. And as I said, as a beta site, we're looking to make this as robust and as appropriate as possible, but we've been looking to some of the world-class work done by Ontario Shores, MH, and others on this specific topic. So you'll see a number of tabs. Know the signs. So we just put a few helpful things that they can look for in a loved one if they might be worried about it. Then there's the Talk tab. A positive way of engaging to make sure that a conversation with respect to mental wellness continues. After that, listen. Something politicians don't do enough of, I think. Remember, we have 2 ears and 1 mouth. My dad used to tell me, listen twice as much as you speak. This is a way of active listening, which is often critical within the context of wellness. And then be knowledgeable. And of course, this is about stigma in general, but the Durham Wellness Hub is really about knowledge at the end of the day. It's bringing tools and information, but also allowing someone struggling themselves or a family member who's worried about someone or a friend to gain knowledge about what is out there in the Durham region with respect to supports. So this is a part of the site that is meant to be basic, because as I said at the outset, Durham Wellness Hub is not a substitute for professional guidance or for medical intervention. But we already know people are out there looking. The talk we're seeing about stigma is leading to them to search, and we're hoping they can find the hub. So, contact. Let's go to that for our wrap-up. In many ways, we've decided to do a soft launch, and I hope I've done my best Steve Jobs here today, without a turtleneck. But this is the Durham Wellness Hub. But it's only as good as the agencies, groups, and partners that we hope to gain from this soft launch. As you can see, we want organizations to connect with us. If we don't have full details correct, if we need to add more details, we want to do that. We hope they may designate someone on their team to be the calendar updater for the Durham Wellness Hub, so that if an organization, Community Living or Canadian Mental Health Association, Durham, if Durham College and the great mental health professionals here have a really cool event, reducing stigma or talk, we want them to be able to populate this for us. So as a hub, the hub is the center for all the different spokes. And the most amazing part of the collaboration that our team, and I want to thank my team for their amazing work, the most amazing and inspiring part of these consultations over the last 8 months is there are a lot of spokes. There are a lot of supports out there. Increasingly, there's a lot of service agencies, like Community Living Durham and others, even programs like Big Brothers, Big Sisters with mentoring for youth. There are a lot of options. But sometimes they're hard to really navigate when someone's wanting to find supports quickly. So the hub is only as strong as its spokes and its support. So what we really want to do is challenge organizations, challenge people that may be watching this video afterwards or watching online today to help us make the hub better, so that when we turn from the beta launch today to the final product in May, we're going to have the most robust tool of its kind in Canada. Very excited about that. And that's a great segue to pitching our next event in this mental health program. On May 21st, we're having an event in Durham specifically focused at youth mental health. And so by then we will have the hub refined. We will hopefully gain more specific feedback on tools for young people and how they can best navigate. And some of these partners we've gathered throughout the last 8 months will be part of this session, looking specifically at some of the unique needs facing young people in an age of social media, preference bubbles, and pressures. How can we provide tools to make sure that young people know that the supports are there? So that's on May 21st. So I hope you found the hub informative, interesting, and I'm hoping that you can share it and help us make it better. I want to thank all of the amazing groups that have taken time to meet with me and my team. Often they would say, you're the federal MP, you know, health is a provincial issue, but I think we're all in this together. So the more we talk, we show people, as my friend Michael Landsberg likes to say, that they're sick, they're not weak. Much like we would instantly know what to do with a physical injury, we have to make sure we're in a society where we know very quickly what to do with a mental wellness issue, just the same way. So I'm hoping the partners really help me make this as good as it can be. So thank you to Faye and to Mark from the Canadian Mental Health Association Durham, one of our early meetings on the subject. Thank you to Don and Peter here at Durham College. Isn't this an amazing global classroom? Maybe we do have a few global people tuning in on Facebook today. But thank you very much for being a part of this soft launch. And since there's many mental health providers and professionals here, if any of you have any questions, I'd be happy to answer them. But thank you for being a part of it. Does anyone have any questions?
Oh, I just had one. So you're going to be launching this in May. So this is just the beta that you're doing?
This is the beta. It is live.
It is live.
It is live as of today. But we fully intend to rework it and make it even stronger, because it's hard. Most of the information we've drawn that is on the hub now is from existing websites or from a result of our consultations with people. So it is really a flow through of information, but we want all of the groups that have been a part of those consultations to be able to review what information is on there and to see if it's an appropriate presentation, if they would like more information or less. Our hope is, because we're really just sharing their existing information, that it's not really a question of participating, it's how can we take this to the next level. What struck us almost the most of this, two things: how many resources were out there, but two, how little people know about them. You know, we spoke to physicians who specialize in mental health that didn't know about some free programming. And why would they? We've got agencies and charities, we've got regions, we've got local, municipal, we've got provincial, we've got so many different layers and such rising need. Sometimes, you know, you're not given a primer on this at medical school to navigate an already busy environment. So what we're trying to do is to do that. Part of the consultations, I put requests for feedback in my householders that I send as a member of parliament, in my calendar that I send to constituents. If you're within the physical riding of Durham, you got my calendar, and hopefully it didn't go right in the recycling bin. But we found a gentleman who came to see us that told me, we listed a bunch of service providers in our calendar, including a few that had free classes. He came to me, didn't have insurance, he's a senior on fixed income. He thought because he didn't have insurance that he couldn't have any counseling type sessions. And through our calendar, an old style physical guide, he found a free class run by one of the agencies in the library setting, just a more group talk counseling session. So we found, even in the context of our consultations, we were connecting people with resources and things happening. So that's really what led us to the hub. How can we do this beyond the physical old community guides that we used to get on signing up your kids for swimming, and here's a few classes on the mental wellness issue. By making it a living, breathing, constantly updating hub, hopefully enlisting the groups as partners, we feel by May it will be in a place where we can say the beta launch is over. We're very happy with it, and hopefully you guys have someone like Mark who can be the lead to update the calendars and say, hey, let's add something else to this. So we're very excited about it, and we hope the groups, as they learn about it, are too. Yes.
Hi, Aaron. I'm from Ontario Tech U, across the parking lot, and really on behalf of Stephen, great project, great tool. Here with AVP Student Life, Olivia Petrie, and we're really excited about what really this will offer for our students. Just related to what you were saying before, I've dealt with, and I know a lot of my friends and colleagues have senior mental health care, and I think you touched on a story about your pamphlet. This tool I can see being valuable for seniors and caregivers of those seniors, really connecting with mental health resources. Is that?
Yes, thank you. While the focus of our first mental health summit, as I'm calling it, in May, is going to be youth, the site, as you can see from how we break down the resource tabs, is meant to be easy to navigate based on your own unique circumstances, or, as I said, supporting others, the unique circumstances of a family member. We had, one of the most passionate advocates we had come into our office from my requests for constituents to let me know their stories, was a family living with dementia of husband, father in the home. Want to keep them at home, but struggling. And so we're hopefully going to make it so that you can guide supports for seniors, for families, for youth, for specific groups like Indigenous Canadians, LGBT, these sorts of things. And if we need to build on that, even this morning, I'm a veteran, I'm a former veterans minister, and I realized last night when I was writing my presentation, we don't have a tab for first responders. And they may when they look at the site, that may be the first thing they're looking for. They may not want to navigate through the mental health tab. And I'm very proud of the fact that Wounded Warriors Canada is based in Whitby. It's the biggest national charity working with first responders on operational stress, mental health issues from uniformed service. So, as I said, we've got amazing support in groups working on these issues in Durham, but a very hard way to navigate them. 4 levels of government, a lot of agencies wanting to do good. Everyone is rowing in the same direction. The hub is meant to coordinate it a bit better and to give us a living, breathing site to do that. And so thank you for the university, and congratulations on Ontario Tech's launch. I did a little video from Parliament Hill. I'm very happy because whenever in Ottawa I talked about the UOIT, they thought I was speaking about U of T. And I say, oh, that's the old university from 100 years ago. Ours is the new innovation hub for Canada, so congratulations. Please pass that to Steve as well. All right, well, listen, thank you very much. I thought I was doing this virtually for an online audience, so it means so much to me that some of you, whether you were ordered or voluntold, it is so much better to do this and to see reactions. And from some of the reactions I saw, I think you see the value in this. So thank you very much. If you have any direct feedback, we'll be talking to many of you. Again, Peter, thanks to you and Dawn for letting me do that. And hopefully you can click on this. It's also optimized for phones, because of course within 10 years there's going to be no more desktops anyway. So this comes up in a little different form on your phone, but all the detail and all the tabs are there on mobile devices as well. Thank you very much. I appreciate it.